1 in 5 people over the age of 60 is living right now with seriously impaired circulation in their legs, and most of them have no idea. They think heavy legs at the end of the day is normal. They think nighttime cramps are just part of getting older. They think cold feet are just the way their body works. None of that is normal. Every single one of those is a warning signal your body is sending you, and if you keep ignoring it, the next stops on that road are varicose veins, blood clots, and, in the worst case, sudden death from a clot that breaks loose and travels to your lungs. I'm Sam Waterling. I've been a practicing physician for 15 years, and I have watched this exact sequence play out in real patients. That is why I'm making this video. The system isn't designed to keep you healthy. It's designed to treat you once things go wrong. That's where the money is. Subscribe to Dr. Waterling and hit like if you want the truth instead. Help this channel reach 100,000 subscribers. Every single person counts. Let's start from the beginning. Basic anatomy. Simple and clear. Your body has 2 types of blood vessels, arteries and veins. Arteries carry blood away from the heart to every organ and tissue in your body. That's the delivery system. Veins carry blood back to the heart. That's the return system. Sounds straightforward, but there is one major engineering problem buried in this setup. Blood in the veins of your legs has to travel upward, directly against gravity. Every second of your life, your venous system is fighting gravity to push blood from your feet all the way back up to your chest. How does it manage that? Through 2 mechanisms working in tandem. The first is the muscle pump. When the muscles in your legs contract as you walk, they physically squeeze the veins around them and push blood upward toward the heart. The second mechanism is venous valves. Small flaps of tissue inside the vein that work like one-way gates. They open to let blood pass upward, then snap shut to prevent it from sliding back down. This system is elegant, efficient, and remarkably reliable, right up until it starts to break down. That breakdown is called chronic venous insufficiency, and it is the #1 reason for poor circulation in the legs. Venous insufficiency means the valves stop working properly. They wear out over time, they stop closing tightly, and blood begins to leak back downward with every heartbeat. That blood pools in the veins of your calves and ankles. Pressure inside the veins climbs. Fluid starts pushing through the vessel walls into the surrounding tissue, and that is where swelling comes from. That is why your shoes feel tight by evening. That is why your ankles feel full and heavy, why there is a dull, aching pressure that builds through the day. This is not tiredness. This is blood stagnation, and it is a chronic condition, which means it does not get better on its own. Without intervention, it progresses, slowly but reliably year after year. Why do the valves wear out in the first place? There are several reasons, and most of them are preventable or at least manageable. Age is the primary driver. The walls of blood vessels lose elasticity over the decades, and the valve tissue weakens with them. Excess body weight dramatically increases the mechanical pressure on the veins of the legs. Prolonged sitting or standing shuts down the muscle pump. Blood simply stagnates because there is no movement to push it. Pregnancy increases pressure on the pelvic veins and disrupts drainage from the legs. And genetics plays a real role. If your parents had varicose veins, your personal risk is substantially higher than average. One thing I want you to understand clearly: venous insufficiency is not a cosmetic issue. It is not about small visible veins on your legs. It is a structural failure of the vessel wall with serious downstream medical consequences. Now let's talk about the second mechanism behind poor leg circulation, one that almost nobody discusses. It's lymphatic congestion. Your lymphatic system is a separate network of thin vessels running alongside your blood vessels throughout your entire body. These vessels carry lymph, a clear fluid that collects everything the tissues need to get rid of: cellular waste products, toxins, excess water, immune cells that have finished fighting an infection. Think of it as your body's drainage and waste removal system. Here is the critical difference from the blood circulation. The lymphatic system has no pump. None. There is no lymphatic equivalent of the heart. Lymph moves exclusively because the muscles around it contract. When you move, lymph flows. When you sit at a desk all day or stand in one place, lymph stagnates. It backs up into the tissues and contributes directly to swelling and heaviness in the legs. There is one more factor that most people would never connect to their leg problems: the condition of the lower spine. The major lymphatic collecting vessels, the trunks that gather lymph from the entire lower half of the body, run very close to the lumbar vertebrae, the bones of your lower back. If there is muscle tension, poor posture, or vertebral misalignment in that zone, it creates a physical obstruction to lymphatic drainage from the legs. The result is that patients complain of leg swelling and heaviness at the same time they complain of lower back pain. And they treat the back separately and the legs separately, never understanding they are looking at a single interconnected problem. When lymphatic congestion becomes chronic and severe, it progresses to lymphedema, a serious condition where the tissue hardens, the skin darkens, tissue nutrition is impaired, local immunity drops, and non-healing wounds and ulcers begin to appear. Let me now walk you through where all of this leads if it goes untreated. I want you to take this seriously, not with panic, but with a clear-eyed understanding of what is actually at stake. The first serious complication is phlebitis. Phlebitis is inflammation of the vein wall. When blood stagnates for long enough, it irritates and inflames the vessel wall from the inside. The vein becomes tender to the touch. The skin over it turns red. There is swelling along the course of the vessel. This is no longer just discomfort. This is an active inflammatory process that requires medical treatment. The next step up from phlebitis is thrombosis, the formation of a blood clot inside the vessel. Stagnant blood combined with an inflamed vessel wall creates the perfect conditions for clotting to happen right inside the vein. A thrombus, a dense, solid clot, forms and partially or completely blocks the vessel. Blood flow is disrupted, the leg swells further, pain intensifies. The skin may develop a bluish tint. If the clot forms in a superficial vein, that's unpleasant and painful, but manageable. If it forms in the deep veins of the thigh or calf, that is deep vein thrombosis, and that condition is life-threatening. Why life-threatening? Because a clot in a deep vein can detach at any moment. During a sudden movement, during straining, even during sleep. Once it detaches, it becomes an embolus, a traveling clot. It enters the general bloodstream and flows exactly where the veins lead, to the heart, and from there, into the lungs. In the pulmonary artery, it lodges and blocks blood flow. That is called pulmonary embolism. It is one of the fastest killing events in clinical medicine. A person can die in minutes, without warning. They simply get out of bed in the morning, and that is it. This is why I have zero tolerance for treating venous problems as trivial. They are not trivial. They are a potentially fatal condition with clear, identifiable early warning signs. And if you catch those signs in time, tragedy is entirely preventable. There is one more complication that gets discussed even less than the others. Neuropathy. Neuropathy means damage to the nerve fibers caused by failure of their blood supply. Nerves, just like every other tissue in the body, require a constant delivery of oxygen and nutrients through the blood. When circulation in the legs is compromised, the nerves are among the first structures to suffer. You feel numbness, a sensation that the leg has gone soft or cotton-like. You feel tingling, burning, pins and needles. Sometimes pain that has nothing to do with exertion, pain at rest, or pain that wakes you at night. Many patients live with these symptoms for years, blame a pinched nerve or a spinal disc problem, treat their spine, and get no real relief because the actual cause is vascular. This is a genuine and common clinical error, mistaking vascular neuropathy for a spinal origin problem. Without addressing the circulation, these patients do not get better. Now, I want to give you two simple tests you can do right now without leaving your seat. The first test is for hidden edema, hidden swelling. Press your thumb firmly into the inner surface of your calf, where the bone is closest to the skin. Press with moderate pressure and hold for 5 seconds. Release. Now look carefully. If there is a small pit or indent left in the skin that doesn't spring back immediately, that is a sign of hidden edema. Excess fluid has accumulated in the tissue. It may be invisible to the eye, but it is there, and it tells you that venous or lymphatic drainage is already compromised. This is called pitting edema, and it's one of the most reliable bedside signs in clinical medicine. The second test is for skin temperature and color. Do this in a warm room when you haven't been outside in the cold. Undress and look at both legs side by side. Compare the color of the skin on the foot versus the calf. Touch the foot and the calf, assess the temperature with your hand. What is normal? Both legs equally warm, skin color uniform without patches. What is a warning sign? The foot noticeably cooler than the calf. Skin that has turned pale, bluish, red, or darkened. Visible patches of uneven color, or a prominent surface vein network that looks like a mesh or web under the skin. Any of these indicate disrupted blood flow, not necessarily severe, but already requiring attention. If either test comes back positive, you need a diagnostic workup. The most important first step is a venous duplex ultrasound with Doppler. Doppler is a technique that uses sound waves to measure not just the structure of a vessel, but the actual speed of blood moving through it, the condition of the valves, the presence of clots. It is fast, painless, completely safe, and inexpensive. Second, a blood panel. 3 specific markers. D-dimer. This is a marker of active clot formation happening right now inside your body. Blood glucose. Elevated blood sugar destroys both vessel walls and nerve fibers over time. And cholesterol. Excess cholesterol builds up on arterial walls and restricts blood flow. Together, these 3 tell your physician the full picture of what is happening inside your vessels. Now, exercises. 3 exercises that genuinely work. I have been prescribing these to patients for years, and the results are visible quickly. Why do exercises help with venous insufficiency at all? Because the muscles of your legs are your secondary heart. I said this earlier, and I want to emphasize it now. Your heart pumps blood downward to your legs through the arteries. Gravity assists that, it's easy. But the return trip from the legs back up through the veins, the heart cannot accomplish on its own. It is too far away. That is the job of your leg muscles. Every contraction of the calf, every movement of the foot is a small pump that squeezes blood out of the veins and pushes it upward. When the muscles are inactive, the blood stops moving. When they contract, blood flows. This is not philosophy, it's physiology. It cannot be negotiated with. It is precisely why people with sedentary jobs develop varicose veins and chronic edema far more often than people who stay active. The first exercise is called the venous pump activation. Sit in a chair, back straight, both feet flat on the floor, parallel. Now lift both toes upward, heels stay on the floor. Hold for 1 second. Lower the toes, that is 1 repetition. Do 40 repetitions on each leg. You can alternate legs or do both simultaneously. What is happening inside your leg at this moment? When you raise the toes, the tibialis anterior, the muscle running along the front of the shin, contracts. When you lower them, the gastrocnemius, the main calf muscle, contracts. And it is the calf muscle that, with each contraction, squeezes the deep veins of the lower leg and pushes blood upward toward the heart. This movement is a mechanical replica of walking from the venous pump's perspective. Why does that matter? Because the deep veins of the calf are exactly where the most dangerous blood clots form. This exercise drives blood flow precisely where it is most needed, and you can do it at your desk, invisibly, without standing up. 40 repetitions take under a minute. Do it every hour throughout the workday. The second exercise is the supine walking simulation. Lie flat on your back on a firm surface, legs straight and extended. Now alternately raise and lower your heels from the floor. Right heel up, left heel down, then switch. Simulate the rhythm of walking. Keep the pace calm and steady. Continue for 1 to 2 minutes. This exercise reaches deeper than the first. It activates not just the superficial, but the deep venous highways of the legs. It also gently stretches the fascial sheaths, the tough connective tissue envelopes that surround the muscles, vessels, and nerves like a casing. When fascia is tight or shortened, it compresses the vessels and lymphatic channels from the inside. Most people are unaware of this, but tight fascial compartments in the calves are a direct cause of chronic swelling in people who move around but still have puffy legs. This exercise gradually releases fascial tension and improves microcirculation. Blood flow in the smallest capillaries, the ones responsible for delivering oxygen to individual cells and keeping nerve fibers alive. The third exercise is the vascular pump for the thighs. Stand with your feet shoulder width apart. Soften your knees, not a deep squat, just a slight bend so the legs aren't locked straight. Now make small bouncing movements up and down, not fully straightening the knees at the top. 1 cycle up and down equals 1 second. Keep the pace fairly brisk. 30 repetitions. This is the most powerful of the three from a hemodynamic standpoint. Hemodynamics is simply the study of how blood moves through the circulatory system. During this exercise, the thigh and calf muscles fire simultaneously, creating a pumping effect across the entire venous system of both lower limbs at once. Research in exercise physiology has shown that intense contraction of the lower limb muscles increases the throughput of the capillary network, the smallest vessels, by as much as 600 times compared to a resting state. Not 6 times, 600. That is why your legs literally feel revived after this exercise. The heaviness lifts, fatigue dissolves, the skin warms up. Arterial inflow to the feet accelerates. Venous return speeds up. The muscles receive a fresh supply of oxygenated blood. When should you do all three? In the morning, immediately after waking. During the night, while you are lying still, blood gradually pools in the legs. The morning routine restarts circulation before you even stand up, clearing the overnight congestion. In the evening, after the workday, especially if you sat most of the day, this discharges the accumulated stagnation and prepares your legs for proper overnight recovery. If your job requires prolonged standing, do the first exercise every hour while standing. 15 minutes a day, that is all this requires. No gym membership, no special footwear, no expensive medications. 3 exercises daily. Poor leg circulation is not an isolated leg problem. It is a whole body problem. When blood stagnates in the legs, the heart has to work harder to overcome that resistance. And chronically elevated cardiac workload is a pathway to hypertension and heart failure. The brain receives less oxygen because a portion of your circulating blood is simply sitting still in your legs instead of moving. That is where chronic fatigue comes from. Difficulty concentrating, memory that feels slower than it used to. Sleep deteriorates because nighttime cramps and leg discomfort keep waking you. Mood drops, and this is not a figure of speech, this is neurobiology. Chronic pain and disrupted sleep directly reduce serotonin levels in the brain. All of this traces back to what looked like, quote, just a little leg swelling. This is why I tell every patient in my office, do not wait until this becomes varicose veins. Start addressing the problem at the discomfort stage. Here is something worth knowing about age and how it changes the picture. After the age of 50, venous valves wear out approximately twice as fast as they do in younger adults. And lymphatic drainage in people over 60 slows by an average of 30 to 40% compared to what it was at age 30. That means risk accumulates with every passing year. What was mild discomfort at 30 becomes a significant vascular condition at 60. The same symptoms, the same amount of time on your feet, the same lifestyle, but a very different biological reality underneath. How old are you? Write it in the comments. I want to understand the age range of the people watching this so I can tailor the recommendations in future videos to the risk groups that matter most here. Here is the practical bottom line. If you have leg heaviness by evening, start doing the 3 exercises in this video every single day. If you have swelling, nighttime cramps, numbness, cold feet, or any change in skin color, get a venous duplex ultrasound with Doppler. It is affordable, it takes 30 minutes, and it will give you a definitive answer about the state of your vessels. Get a blood panel, D-dimer, glucose, and cholesterol. Those 3 values give your physician the complete vascular picture. Do not wait until the pain becomes unbearable. Do not wait until the swelling becomes permanent. Venous insufficiency caught early responds well to conservative treatment. No surgery, no hospital stays. Advanced deep vein thrombosis is an intensive care situation, and the outcomes are not always good. The choice is yours to make, and you can make it today. Your doctor isn't going to bring this up during your appointment. There's no billing code for prevention, and there's no profit in a patient who stays well. I tell you the truth because I believe you have every right to have it. Help Dr. Waterling reach 100,000 subscribers. Subscribe, hit like, and share this with someone who needs to hear it right now.